Childhood obesity is, and probably a bit more recently, become quite a challenge for healthcare professionals. I think that is partly because they're not aware of how big a problem it is, and they also are not sure where they should start with it. Because they've always been geared towards treating obesity, we've got to look after the people who've got the problem rather than saying, we probably need to leave those and work on prevention, working with early years, working with pregnancy, so that we can get them on healthy eating, nutrition habits and activity before it becomes a problem. The presentations together today were excellent. There was quite a range of research being done, plus policy, what was happening in the communities. And I think that means healthcare professionals have at least two things to do. They have to look at the research, particularly in relation to obesity. What is the evidence that we can work with pregnancy, early years, but also be very aware of how you can work with local authorities and say, what is their policy? How can we broaden the prevention angle and work with other health professionals, with even other professionals, not just healthcare professionals, education, community, social workers, that sort of thing, who will also have a big influence on, and I think the speakers did a good job of that balance of the research and also putting it into practice. Practical resources can be a benefit if they know how to use them well. I think training of other professionals, even other parents in the community, is a good way to go. But the resources that they provide must be appropriate so that they're geared at their level, they understand what the message is, and then they can deliver it to other people in the community. So yeah, resources are definitely important because they need something to go away and say, I've got this to base on what I'm saying. But they need to be practical, very practical.